Hi everyone, my name is Mazhar Hussain and today I'm here with my teammate Hashim Abbas.
We are here to discuss our global perspectives topic, which is thalassemia.
Now, thalassemia is a disease. A good question is what kind of disease and what made us choose it? So, thalassemia is an inherited blood disease. So, it's genetic, goes from parents to offspring. And what it basically causes is that red blood cells can't carry enough oxygen because of problems with hemoglobin production.
It makes you weak physically and mentally. You feel more sleepy. It's kind of an anemia, if I'm not wrong.
Thalassemia is usually accompanied by anemia, and there's fatigue is one of the main symptoms. There's facial bone deformities, and there are a lot of thalassemia cases in Pakistan.
And the main reason for that, we can say, is our culture itself. Because in Pakistan and countries around us, like for example India and Bangladesh, we promote consensual marriages, cousin marriages. We promote that a lot in our culture because that is something that has been coming down from pedigree to pedigree to pedigree. And we have also started this tradition that we will feel ashamed, but we will not go to a genetic screening test before starting a premarital relation with someone.
Yes, exactly. And so that is our main aim, to try and promote genetic testing, try and promote prenatal testing.
The key issue that our group is targeting is the lack of treatment and chelation therapy for thalassemia. It is the UN SDG 3 goal target 3.2 and 3.7. Helping to prevent mortality and ensure universal access to sexual and reproductive health care to further eradicate genetic defections.
Our salient aim is to create awareness about thalassemia and premarital genetic compatibility testing.
Moving over, the main reason we chose this topic.
Yeah, there are, of course, especially in Pakistan, a lot of diseases, a lot of problems to talk about. There's not just one. So why choose thalassemia? And well, the first answer is that thalassemia is actually much more common than you'd expect. There are about 100,000 registered patients, but the statistic is old and unreliable. The real number is likely much higher, to around, say, 150,000 or maybe even 160,000. And the amount of carriers is especially high. It ranges from around 5 to 8% carrier rate. That means 5 to 8% chance that a Pakistani, carries a thalassaemic gene. Now, the next reason, of course, the actual reason that we chose this, is because many countries like Greece, Cyprus, China, who had thalassemia patients greater than in Pakistan, they have successfully ended thalassemia just by preventing new thalassemia patients. So by the next generation, there were essentially no thalassemia patients. And so that's what we're trying to do, to try to end thalassemia, and we together as a nation can do this.
Speaking in Pakistan, one of the major thalassemias which is in Pakistan is beta thalassemia trait frequency. The frequency of this trait ranges between 5 to 7%. Thus, there are more than 10 million carriers in the country, and every year around 5,000 children are diagnosed to carry beta thalassemia major, BTM, in Pakistan.
And it should also be noted that all of these statistics are unreliable, which goes to show how really unreliable and how bad the system is in our country, and that we need coordination.
Another reason for us choosing this topic was the general neglection that was shown by the society in Pakistan towards this disease. We're not taking this as seriously as it should be taken. As my team leader, Mazhar, said in the start, that other countries where they only had a hint of thalassemia, they started working on it as soon as possible, because they know if it spreads more and more and more and people don't do premarital testing, it will just continue to spread. And that is something that we do not want in the country.
Why is thalassemia a threat? As obvious as this may seem, thalassemia is actually not lethal with proper care. We visited Noor Thalassemia Foundation, which is a non-profit organization that helps thalassemia patients. It gives them free hematologic consultancy. It gives them free chelation therapy, which is a therapy that we need. We'll be talking about this later as well. And it also gives them blood transfusions. Now, this is the main part. Thalassemia patients, beta thalassemia major patients, which are the majority of them, require about 3 to 4 blood transfusions per month, and that is a lot of blood. About 2.4 million donations are collected in Pakistan each year, and about 1/4 of these are consumed by the thalassemia patients alone. So this is definitely nothing small. And the next thing about this is that without care, the thalassemia patient usually wouldn't last very long. Let's say they live about to the age of about 15. They'd be weak and they couldn't be able to do much exercise, and they wouldn't be living much of a life.
Well, speaking about the different types of thalassemia now, there are two main types of thalassemia. There is alpha thalassemia and then there is beta thalassemia. Different genes are affected for each type of thalassemia. It can cause mild or severe anemia, as we mentioned. Anemia occurs when your body does not have enough of the red blood cells or hemoglobin.
Well, we eradicate it just like how all the other countries we've mentioned and more have done it. We can eradicate it realistically by preventing it. Now, thalassemia is very expensive to treat, and the only permanent option is a stem cell or bone marrow transplant, which, although now is becoming more and more feasible due to advanced scientific methods. This information was courtesy of Dr. Rohit Kapoor. But still, for a country like Pakistan, which is neck high in debt and almost bankrupt, almost about to default, it's just not an option. So the only realistic option is testing. By the next generation, we will have ended thalassemia if every marriage that takes place now is tested beforehand to check if we have any kind of disease in it.
So just to confirm, there is no sudden way of ending thalassemia. It's going to take a long time.
Realistically, yes, you could say we can perform stem cell transplants on every single patient, but that's honestly not going to happen. Not now, maybe in 100 years, but not now. So we're going to need to wait a good while for that to happen. So if you see the symptoms of thalassemia in a child about 8 to 9, maybe younger, you should definitely go to a doctor and consult a hematologist. The signs are, pale skin. The main sign is fatigue, very severe fatigue, pale skin, all the signs of weakness. The child may have facial bone deformities. And he said, if usually in the case of facial bone deformities, that is an extreme case, and in such a case, the parents will know at the birth of the child that he had thalassemia, because in this case it is very noticeable, but this is not always the case. And the thalassemia gene, and a very interesting thing about the thalassemia gene, is that this actually exists originally only here in the Middle East and Southern Asia, Southeast Asia, because of malaria. The thalassemia gene is resistant to malaria, but at the cost of being absolutely useless. So if you see the symptoms of thalassemia in a child about 8 to 9, maybe younger, you should definitely go to a doctor and consult a hematologist. The signs are, pale skin. The main sign is fatigue, very severe fatigue, pale skin, all the signs of weakness. The child may have facial bone deformities. And he said, if usually in the case of facial bone deformities, that is an extreme case, and in such a case, the parents will know at the birth of the child that he had thalassemia, because in this case it is very noticeable, but this is not always the case. And the thalassemia gene, and a very interesting thing about the thalassemia gene, is that this actually exists originally only here in the Middle East and Southern Asia, Southeast Asia, because of malaria. The thalassemia gene is resistant to malaria, but at the cost of being absolutely useless. So,
as we mentioned earlier, the two main types of thalassemias, which was alpha and beta, we're going to be explaining and giving you an in-depth view of how these two work. In alpha thalassemia, you get two genes from each of your parents. If you inherit one mutated gene, you'll have no signs or symptoms of thalassemia, but you are a carrier of the disease and can pass it on to your child. Now, if you get two mutated genes from your thalassemia, signs and symptoms will be mild. This condition might be called alpha thalassemia trait. Now, from the two genes you inherit and one your own gene, If you get 3 mutated genes, your signs and symptoms will be moderate to severe. Inheriting 4 mutated genes is rare and usually results in stillbirth. Babies born with this condition often die shortly after birth or require lifelong transfusion therapies. In rare cases, a child born with this condition can be treated with transfusion and a stem cell transplant.
Then there is the other form, the form that is common in over more than 95% of patients in Pakistan. They suffer from beta thalassemia. Now, beta thalassemia has 3 main forms. There is beta thalassemia minor, beta thalassemia intermedia, beta thalassemia major, and the very concerning thing is that the majority of patients are major, and then there is, of course, beta thalassemia carrier. What carrier means is basically that a person is not actually infected, does not have the symptoms of thalassemia, but he carries the gene and may have symptoms that are too mild to actually affect his life.
Now, the risk factors are pretty straightforward and clear. Family history of thalassemia. Thalassemia is passed from your parents to the children through mutated hemoglobin genes, and certain ancestry. Thalassemia occurs most often in African Americans and in people of Mediterranean and Southeast Asian descent. So, possible complications of moderate to major thalassemia or severe thalassemia may include iron overload. People with thalassemia can get too much iron in their bodies, either from the disease or from frequent blood transfusion. Now, not to take thalassemia in a positive way, but the people with thalassemia, they're less likely to be attacked or in the danger of getting malaria. Too much iron, though, can result in damage to your heart, liver, endocrine system, which includes hormonal producing glands that regulate processes throughout your body.
So, and this iron thing is a major risk factor. This is actually the main cause of death from thalassemia. Iron overload. Because in patients that are actually being treated, as we said, they require about 3 to 4 blood transfusions per month, and that is a lot of iron and other heavy metals like lead and some others that accumulate in excess in the body. These can be toxic, and these can cause the symptoms, the also often causes of death that Hashim just said, such as heart failure, which is the most severe ones. It can also affect the liver as well as other organs. And because of this, thalassemia patients need a treatment called chelation therapy. Chelation therapy is a treatment where doctors use certain chemicals called chelators to remove these excess heavy metals, mainly iron, from the body. And this treatment is quite expensive, and as we all know, if something's expensive, then it is basically unaffordable in Pakistan because of high inflation rates as well as lack of actual development. And about this infection is something, again, really severe about the system in Pakistan, because especially in the least developed province of Balochistan, it's really sad that there have been many cases where thalassemia patients have been infected with diseases like HIV and hepatitis A or B because of infected syringes. And a way to actually prevent certain disorders or certain issues is to use something called leukocyte filters. But these, again, the problem of expense comes back in. They're not that affordable because of inflation rates and the lack of production. And so the government needs to focus on these things. The government needs to focus on healthcare and on thalassemia, and perhaps even more importantly, all the private organizations, because there are a lot of private organizations that don't fully follow healthcare standards, that don't work properly. And of course, none of these coordinate with each other.
The other complication that a thalassemia patient might face is infection. People with thalassemia have an increased risk of infection. This is especially true if you've had your spleen removed. In severe cases of thalassemia, though, a person might come into contact with or in the problem of bone deformities. Thalassemia can make your bone marrow expand, which causes your bones to widen. This can result in abnormal bone structure, especially in your face and skull. Bone marrow expansion also makes bones thin and brittle, increasing the chance of broken bones. The next thing that may affect a severe thalassemia patient is an enlarged spleen. The spleen helps your body fight infections and filter unwanted. As we mentioned, that the people who are facing the infections or severe infections in the case of thalassemia are the ones which have had their spleens removed. Thalassemia is often accompanied by the destruction of a large number of red blood cells. This causes your spleen to enlarge and work harder than normal. An enlarged spleen can make anemia or weakness worse, and it can reduce the life of the transfused red blood cells. If your spleen grows too big, your doctor might suggest surgery to remove it. And lastly, we have the slowed growth rates and heart problems. Now, coming over to the prevention of thalassemia.
Now, prevention is pretty straightforward. First of all, obviously, since it's genetic, you can't actually prevent it, but you can prevent a patient from being born. This can be done using genetic compatibility testing. In this case, two partners who are about to marry test each other. The only thing they have to provide here is just a sample of saliva, and they have to wait a while, of some days or a week maybe, nothing big. And then the doctor's lab techs will test the saliva to check if they're compatible. In the case of the two partners not being compatible, what this would mean is that there's a high chance that if they produce a child, that child would be infected with thalassemia. And so this is really severe. And if this happens, that two partners who want to marry, they can't because of this reason, then they have a few solutions. They can use...
Point cutting you out, sorry, Mazhar, there, but if two parents, they do have thalassemia, or one of them is a thalassemia carrier, consider taking with a genetic counselor. Consider going to a genetic counselor for guidance if you want to have children. There is a form of assisted reproductive technology diagnosis which screens an embryo in its early stages for genetic mutations combined with vitro fertilization. This might help parents who have thalassemia or who are carriers of a defective hemoglobin gene have healthy babies. The procedure involves retrieving mature eggs and fertilizing them with sperm in a dish in a laboratory. The embryos are tested for the defective genes, and only those without defective genes are implanted into the uterus.
Exactly. As I was just about to say, in vitro fertilization, this is the method that they can use. This is what we call test tube babies. In this case, the sperm and the eggs they fuse together in a controlled laboratory environment. And so, of course, they can be checked. If what will be the child has thalassemia, then this fusion is rejected. If not, then this embryo is planted into the uterus and the woman becomes pregnant and gives birth as any normal woman would. So they still have a child, but it is assisted, as it says.
Now, last, definitely not the least, and not the least important thing we have discussed today, we want to talk about the availability of the care of thalassemia.
For availability, it's definitely surprising to know that a good amount of people in Pakistan have heard of thalassemia. They don't know much, but they've heard of it. In our online survey, about 60 to 70% of people had actually heard of thalassemia before. And this was definitely surprising. Of course, these statistics change in a lot of places, such as in our surveys in school. The students mostly didn't know about thalassemia, depending on whether or not they were science students. And all of the teachers had heard of thalassemia, and most of them were agreeing to donate to thalassemia. Another important thing, of course, is that we encourage everyone here and everyone in the country, everyone everywhere, to donate to thalassemia, because foundations like Noor Thalassemia, they have blood, they need blood, and they most importantly need funds, because funds are the most important. They need funds for development, for chelation therapy, they need funds for blood bags. We were able to raise about 3 big blood bags, which we were able to provide to them further. And then there was also this carnival a few weeks ago, which was held in Karachi, and they support every ticket that a person brought. About 70% of their income from the tickets was going to the patients of thalassemia, which was a really good gesture shown by the government, or because it was a government-held carnival. Yes, even though we're not based in Karachi, we still donated to this because we believe in this cause. We believe in ending thalassemia.
Now, putting this podcast to the end, let's review a few things that we have gone through here today. Firstly, once again, we actually are a group of students from Beacon House, Town Senior Campus, who have chosen thalassemia as our Global Perspectives O-Levels topic. And we wanted to choose this topic because of the following reasons: that it was neglected, it is a great threat to society, and everyone, including us and the people we know who we talk to, want it to be removed. And so there are going to be certain steps that we're going to be taking and promoting those steps. For example,
the most important step is education. I've seen some people who just straight up refuse to acknowledge the disease. We inform them about it, we tell them what it is, and they just say, no, we don't accept this. And in this age, this is really surprising. So since we can't really rely on the government to do these things, we need to take measures into our own hands and need to take responsibility for raising awareness. We should raise awareness about this. We should try to end these social norms that genetic counseling is wrong and that in vitro fertilization is wrong or adoption is wrong, because all of these are suitable methods. All of these are ways we help the society and we prevent suffering, we prevent economic loss. It is what we need to do. And it goes to show how wrong the society is and how much we need to fix it.
We also discussed how the ways we could help to eradicate thalassemia in Pakistan, even though it requires a lot of finances, it requires a lot of hope, but it will definitely pay off in the matter of time. It is a long process, but as people say, trust the process and you will get the result. We also talked about different countries having different laws and we also talked about countries having different laws and different ways of preventing thalassemia before it had even spread. Lastly, we talked about the different types, or the two major types of thalassemia, alpha and beta thalassemia. We hope that this podcast was informational towards all of you, and let's end this butcher that has been killing people and especially children, because it is one of the main causes of childhood mortality. Let's end this and let's move on to a better chapter in Pakistan.
Definitely.
Thank you.
Thank you.